Hello, my name is Dave Satterley with American Ambulance of Visalia. Thank you again for joining us for another episode of Every Second Counts. Today's topic is snakes and snake bites. In the United States, primarily, there's four different types of venomous snakes. We've got coral snakes, rattlesnakes, copperhead, and water moccasin, or otherwise known as the cottonmouth snake. Regardless of which type of snake, most occasions there's no fear of bites or envenomation if you're staying clear of these snakes. Unless you come across one accidentally where you're startling the snake or you're coming across the snake during feeding, there's generally not a great amount of fear. You hold your position and then back away, and generally the snake will pass. With today's episode, we're primarily talking about the state of California. The snakes indigenous to the state of California primarily are the rattlesnake as well as the yellow-bellied sea snake. Yellow-bellied sea snake primarily located in the southern regions, coastal regions of California, whereas the rattlesnake throughout California is indigenous. But with the rattlesnakes and the yellow-bellied sea snake, once again, these snakes are primarily not aggressive. These snakes are only striking and causing envenomation when startled or during feeding. Let's start by talking about some of the do's. If you're struck by a snake, if you're bitten by a snake in fear of envenomation, some of the do's you may want to do. First of all, wash the site. Second of all, place a constriction band about 2 to 5 inches above the bite mark, tight enough where you can still put one finger easily underneath that band. This is not a tourniquet. We're only trying to slow the venom into the system. Thirdly, if you can, take a pen and circle the area around the snake bite area so that the physicians at the hospital can determine some of the infiltration of the venom and the swelling going along with the venom itself. If there's pain involved, please use Tylenol only for the pain. With the individual themselves, it's best to place them flat, keeping the extremity that was bitten lower than the level of the heart will also help slow the speed of the venom into the system. Those are some of the do's that you want to do. Obviously, getting this person into a medical facility as expeditiously as possible is also something we want to do. Whether there was venom injected or not, it's a good idea to get them in. There are fears from non-venomous snakes as well, as far as tetanus or other types of infections. Okay, now that we've talked about the do's, let's move on to the don'ts. Some of the things you don't want to do is, one, please don't go chasing the snake, trying to keep it as an identifier. We're going to treat this snake bite as a poisonous snake until proven otherwise by healthcare officials. If the snake was killed in the process of the bite, yes, sever the head, bury the head, and bring the body of the snake for identification, but only in the event that it was killed in the process of the bite. Another thing we don't want to do is use any of these fancy evacuators or suction type devices thinking that we can extract the venom from the individual that was bitten. They've been proven to be ineffective, so please do not use any of these devices. Another thing, no blood thinning agents. Please don't give the individual aspirin or ibuprofen. These blood thinning agents, or what we might think that they're going to relieve some of the pain, are only really going to help spread that venom more thoroughly through the body, and we don't want that. Fourthly, we want to take this patient and at this point in time, make sure that we're not mistaking constriction band for tourniquet. The constriction band, as described in the do's, is a place 2 to 5 inches up from the bite site, never on fingers, but place 2 to 5 inches up from the bite site. We're trying to stop the venom from moving into the system more readily, but we're not trying to stop all blood flow. So please don't mistake this as a tourniquet that would be more used in a capacity of stopping bleeding or that, and stopping all blood flow. Constriction band, not tourniquet. Okay, now that we've talked about snakes and snake bites, let's move on to some of the things. We talked about do's and don'ts. Let's talk about some of the prevention type things that you might do, especially if you're working in areas where snakes are common, or you're hiking in areas where snakes are common. First and foremost, always just staying alert. You know the old saying, stay alert, don't get hurt. Keeping an eye on the trail, keeping an eye on the ground in areas where snakes might be prominent. Second of all, if you are hiking, if you're out in areas where snakes are prominent, a walking stick. is always nice. Maybe the snake itself is going to possibly strike at the stick versus striking at you. This might also avoid a snake bite or snake envenomation. When we're talking about apparel, if you're in areas where snakes are prominent, wearing proper foot gear, possible boots, calf-high boots, shoes on might prevent an accidental snake bite or at least repel some of the bite force. When we're talking about overall general prevention, again, using headlamps if you're hiking at night, using flashlights if you're hiking at night, and overall, in these areas where snakes are prominent, talking, maybe conversation alone is enough. They many times focus off of heat, but they also focus off of vibration, and they might scurry or at least get out of your immediate path if they hear you coming. Hey everyone, thanks again for joining us with another episode of Every Second Counts. Please don't forget to like, subscribe, and follow us on Facebook and Instagram. Please be safe out there and have a great day.